Welcome to the University of Texas Health Science Center San Antonio Department of Urology. Previously a division of general surgery, the Department of Urology was established in September of 2004. Our mission is education. We provide urologic education for the students and doctors of South Texas. At the medical school, we provide basic understanding of urologic pathophysiology to the MS1 and MS2 students. Through the MS3 and MS4 clerkships, students are given chances to directly interact with the residents and faculty and participate in the teams as they take care of their patients. Multiple clinical and basic science research opportunities are available to the students as well. Our main focus in graduate medical education is the residency training, which we'll describe further as we go along. The department and faculty also participate in multiple fellowship and CME efforts to continue lifelong learning goals of urologists throughout the state and nation. The goals of the residency program are to provide quality education for residents from pediatrics through geriatrics and principles of basic science through clinical medicine. Our graduates enjoy unlimited opportunities whether they pursue academics or enter private practice. Beginning in the 2019-2020 academic year, we changed from a 1+4 to a 5-year program. Having more direct involvement in the PGY 1 year allows us to develop a more robust educational experience. The PGY 1 year includes 6 months of general surgery, 3 months of urology, and 3 months of proscribed electives. Anesthesia, nephrology, and interventional radiology are the electives for the 2019-20 year. There are 4 residents at each level, including 3 civilians and 1 military trainee. All rotations are the same for each resident. Some elective time is built into the PGY 3 through PGY 5 years and can be used for research and QI projects with some concurrent clinical responsibilities. Dedicated research time may be possible under new ACGME guidelines, but must be planned well in advance and funding must be available. Part-time research activities are encouraged throughout the residency program, especially during the PGY 3, 4, and 5 years. By rule, there can be no dedicated research time in the PGY 1 or PGY 5 year. Residents are encouraged to work closely with their research mentors to plan research activities well in advance. Our educational program includes the educational curriculum, the clinical rotations, a wellness curriculum, and the clinical research and QI projects. Requirements for graduation include that the resident finish the curriculum, have successful completion of all clinical rotations, complete at least 1 research project alone or as a collaborative effort with others, complete at least 1 good QI project either alone or as collaboration with others, and have at least 1 publication in a peer-reviewed journal. Benefits for the residents provided by the department include educational expense money provided during the PGY 2 through PGY 5 years and memberships in the AUA and Texas Urologic Society. Educational funds can be used for meetings, outside conferences, approved travel and other things, as well as books, subscriptions, and loops, which are usually purchased in the first year. Be aware that these are considered state funds and must comply with all state rules and regulations for expenditures. Please review the handbook in the link provided for the details. Our clinical faculty has grown to 13 physicians and 5 mid-level providers. The urology department has several divisions, including oncology with Drs. Svatek, Bosler, Rodriguez, Hernandez, Kaushik, Pruthi, and Liss. The FPMRS and voiding dysfunction section, including Dr. Kraus and Botros Bey. The endourology section, including Drs. Tsung and Mansour. Pediatrics with Dr. Getz and Baumgartner. Reconstruction with Dr. Rosansky. Male sexual health, ED, and infertility with Drs. Jones, Case, and Kavusi. And the general urology sections with Drs. Reyna, Sepulveda, and others. The addition of our mid-level providers has been extremely helpful to the resident staff by helping with hospital duties and clinic coverage. Residents now participate in a less stressful environment. At the VA, which is the busiest single clinical environment for the residents, the full-time staff are an integral part of the training program. They are especially valuable in teaching efficiency in the clinic and minor procedures that can be done in an office setting. There are many other faculty participating in the community who participate in the training program through their private practice affiliation. Many of these are graduates of the residency or fellowship program and take a special interest in providing our residents exceptional clinical and operative experiences. The fact that they choose San Antonio to develop their careers says a lot about the clinical environment in South Texas. Next, we'll explore some aspects of the urology training curriculum. The urology curriculum is based upon the AUA curriculum, the Urology Review Committee guidelines from the ACGME, and the American Board of Urology requirements. It is reflected in the conference schedule and the rotation schedules. The urology curriculum repeats over a 24-month cycle. All major areas of urology are covered. We have a team approach to the conferences with an assignment for faculty, senior resident, and junior resident for each conference. We have visiting professors at least annually and sometimes more often. Since the call responsibilities represent a significant part of the overall clinical experience, a few words are in order. Duty hours and handoff procedures are monitored closely to assure resident wellness and patient safety is maintained. First, all call for urology residents is home call. When the residents finish their assigned duties, they are encouraged to head home, exercise, eat well, and relax. When on call, they may be called upon to return to their facility to handle patient care issues. The university makes special efforts to mitigate fatigue, including cab fare back home if the resident feels too tired to drive. The call averages 1 to 3, with the super sub and super chiefs taking up the slack when residents are away on leave. Call is shared at UH and the VA. The pediatrics and Santa Rosa Medical Center also share call teams. Each call team includes a junior and senior resident, along with a faculty consultant. Residents have 15 weekdays of leave per year. To limit the disruption caused by a graduation of chief residents and assure there is adequate supervision of the incoming residents, no vacations are granted in June or July. Sick leave can be taken up to 10 weekdays annually. Thereafter, FMLA rules apply. Keep in mind that the American Board of Urology requires at least 46 weeks of training annually. If leave for any reason causes this rule to be violated, the resident may be prohibited from sitting for the board exam despite successful completion of the residency. I hope this summary has been helpful and that your visit to San Antonio is productive and enjoyable. Unfortunately, we can only match 3 of this group of exceptional candidates. We look forward to all the new ideas and perspectives you can bring to the department.